Thank you for tuning into North Point, Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by North Point Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today's guest is Dr. John Gatermann. He is a senior clinical psychologist at North Point Health and Wellness Center. He specializes in working with the 2SLGBTQIA+ community, providing assessment and therapeutic services from early childhood to late adulthood. Dr. Gatermann works from a trauma-informed intersectional framework, which enables him to understand the complexities of identity and mental health care. Dr. Gatermann founded and currently chairs the 2SLGBTQIA+ committee, which formed in 2018 as a call from North Point administration to better meet the needs of the queer community. Apart from his work at North Point, Dr. Gatermann works for the APA's Sexual Orientation and Gender Identity Journal as a manuscript reviewer, and has been an invited guest lecturer at the University of Minnesota on sexual orientation and gender studies for the past 5 years. And he's also been invited as a discussant at the annual APA conference. And today we are joined by Dr. Gatermann for our conversation and an interview on Pride Month. So welcome, Dr. Gatermann.
Thank you, Biftu. Appreciate it. Appreciate the introduction and for having me here today.
Absolutely. Thank you for being willing to talk to us and answer our questions. So like I said, it is June, it is Pride Month, and we are here to talk about the 2SLGBTQIA community. So that's our first question. Can you break down that acronym for us?
Yes, it's a long acronym, and it seems to be getting longer. And there's a few reasons why the acronym is so lengthy. One is just to comment on the restrictiveness of the English language, but all languages for that matter have a lot of parameters around them. And so as we're looking at identity, we want to be able to create new terminology that helps us identify the way that we feel best represents us. And so some new terms come into play, some things that may be a little more ambiguous to mainstream society. And we just want to be able to make sure that we understand why these new terminology is being created and how important it is for people who identify differently than the mainstream. And so you'll see that acronym become longer and probably more letters and numbers being added to it in the coming years. And so, but specifically LGBTQIA+, what that stands for is lesbian, gay, bisexual, queer, questioning, intersex, asexual, aromantic, agender, and then plus, which could incorporate more identities around sexual orientation and gender identity. So the one thing I wanted to comment on is when you're looking at the acronym, understand that this represents not only sexual orientation, lesbian, gay, and bi, and then the other sexual orientations on how people identify, but it also incorporates gender identity. And those are two distinct things. And we'll talk about that as we further go along. Recently, 2S has been adopted, while the term 2S or two-spirit was coined in the 1990s. It was first coined in Winnipeg, I believe, in Canada, as a way of like unifying gender identities and expression for Native American, First Nations, Indigenous identities. But it's an understanding that gender is beyond the binary, that there are multiple variations of gender. And so we've started introducing 2S as part of the acronym to represent the community.
Great, thank you. So let's talk about Pride and Pride Month and raising awareness for the LGBTQI+ community. Why do you think that's important?
Yeah, so Pride specifically was born out of the civil rights movement for, at that time was labeled as gay rights. And this was in 1969, right around when Stonewall uprisings were occurring, which was a pushback against police invasions of predominantly queer establishments. And it was a civil rights movement led by trans women of color, to name two, which is Marsha P. Johnson and Sylvia Rivera, that really catapulted the gay civil rights movement into what we see today. To not go through the entire history of how Pride Month became what it is today, but to kind of shorten it or give an abridged version. Pride is more of a celebration, but also an awareness of what is transpiring in the queer community, whether it's from a social political lens, but also it is a way to understand that we've come a far way from where we began, and even predating the Stonewall uprising, back when the Lavender Scare was going on, when people were being ousted from their federal employment because they were identifying as either gay or lesbian, and then to more current events, what we've seen in the news lately. So it's an awareness around that it's a celebration, but there's also a lot to still overcome and to achieve when it comes from a social political landscape. Now, the politicization of identities has been going on since the beginning of this country. It's been, whether you identify as BIPOC queer, white queer, or you identify from certain religious groups or certain abilities or being differently abled, you name it. In this country, we tend to politicize those components of identity. Now, what that does is it doesn't only impact rights, but it also limits the access to resources or expands the access to resources. And so from a health perspective, it creates many health barriers. So think about it this way, from not asking the right questions at the doctor's office to even the extreme of restricting access to quality care or evidence-based treatments. And then furthermore, the awareness creates the opportunity for understanding, right? So if we have more awareness around the queer community, we have greater understanding of what that community needs. And so if you remove awareness, you tend to erase communities. What I mean by that is you erase the real challenges experienced by the queer community, which makes it easier to deny people access to care, which could proliferate injustices and inequalities.
Let's talk a little bit about health, specifically risk factors for the community. So the 2SLGBTQIA plus community, what are the risk factors? And maybe talk a little bit about social determinants of health as well.
Mm-hmm. Yeah, and so when we're referring to the 2SLGBTQIA plus community, or simply the queer community, it's an acceptable terminology to use. I've also recently heard the term the alphabet community, which
yes. Yes.
But when you're looking at risk factors and social determinants of health, there are some important things to consider. The first thing I want to talk about is just social stigma. So when it comes to queer youth, the social stigma about their sexual choices and their identities, it's particularly difficult. As a young person, you're already experiencing a lot of biological changes. You're experiencing this identity integration process that's going on. You're trying to figure yourself out. You're always doing social comparisons. And so if you're developing not alongside the mainstream when it comes to sexual orientation and gender identity, there's unique challenges to that process. And so, for example, if you're a young trans person who's coming to terms with their identity of transness, and you're starting to, question where you should use the bathroom, and the bathroom at the school is only set up for the binary, male or female, that can be a really difficult process for a young person, trying to make sense of that, because now it's what I'm struggling with on the inside is now being also reinforced externally. And so that becomes an issue. But if you look at, stigma comes in so many different forms, such as discrimination, harassment, family disapproval, social rejection, and even violence. And so this puts 2SLGBTQIA plus youth at increased risk for certain negative health outcomes. Another example would be that, like, say you have a young gay and bisexual males who are developing. They are at risk for a disproportionately high rate of HIV transmission, even syphilis making a comeback, and other sexually transmitted diseases and infections. When you're looking at the adolescent, lesbian, and bisexual female population, they're at greater risk to experience early pregnancy, teen pregnancy, than heterosexual peers. The transgender youth are more likely to have attempted suicide or even thought about suicide than cisgender peers. And so when you're looking at youth specifically, there's a lot of risk factors to consider, but also a lot of determinants of health to consider when doing a full health assessment. Adults, on the other hand, again, different challenges than youth experience, but for 2SLGBTQIA plus adults, higher risk for mental health conditions like depression, anxiety, suicidality, substance abuse, in comparison to the dominant mainstream culture. Compounding the risk factors is you have to, again, it's an intersectional approach. You're looking at all components of identity. So an adult who identifies as BIPOC, Black, Indigenous, person of color, and also as a queer adult, greater risk for being a lower SES, socioeconomic status, maybe differently abled, different religious classifications, citizenship status. All these things factor in when you're considering the health of somebody. And so you have to look at health from an intersectional lens when it comes to identity, to really understand the challenges and barriers to healthcare.
Absolutely. Thank you. Tell us a little bit more about why it's important for places like North Point to offer services specifically for the LGBTQI plus community.
Well, quite often for communities like the queer community, we are reliant on multiple clinics to get healthcare needs met. And so what we're seeing in the community are people becoming overwhelmed by these barriers, such as transportation, long commutes, having to make multiple appointments across multiple days throughout the week, and then having to experience long wait times. So maybe then having to cancel appointments, reschedule work, exhaust PTO, just to make appointments for healthcare. North Point, being a wraparound clinic located in the heart of North Minneapolis, remedies these barriers. And so you're seeing, let me back up for a second. You're seeing an increase in, or a changing demographic within North Minneapolis of people who identify as BIPOC and queer. So for this community, having to go to other places such as the Family Tree Clinic in St. Paul, or Rainbow Health, or Smiley's Clinic, just to name a few around the metro that do affirming care, they're having to make multiple appointments across multiple cities just to get healthcare needs met. And so you look at North Point, it has a lot of these services, and you ask yourself, why can't we make North Point an affirming, inclusive place for BIPOC and queer individuals? Because we're positioned to do so. And so you've seen a big change in how North Point approaches the queer community in order to better meet those needs. I mean, we have highly skilled professionals from various professional backgrounds and expertise, and we're all located under one roof. And so we are in we're in an essential position to kind of close that disparity gap.
Absolutely. And thank you for highlighting some examples of those barriers and risk factors. I think it's good to know and be aware. And also, know that North Point is kind of a one-stop place for dealing with and, sort of addressing those risk factors and other barriers for queer youth. So let's talk a little bit about LGBTQIA plus health issues, and then specifically sexual and reproductive health care. So how are those two linked?
Yeah, so the first is to start off just by a disclaimer. This is going to be a multifaceted response because many people from the queer community are restricted from reproductive care because, again, reproductive care operates from a binary lens. Right? So it's widely marketed towards cis females and cis males. What I mean by cisgender. And so when you look at certain procedures for that matter too, it's even further operating under a binary lens. Good example of this, breast cancer screenings. Much of the time, screenings are advertised towards cisgender women and exclude non-binary and trans folks. So if a non-cisgender person does seek services, they're often met with a lot of microaggressions, macroaggressions, such as misgendering or dead naming an individual, which is just a term that the trans community uses to indicate that the name given at birth is no longer their name, and that usually it's a legal name tied to health insurance. And when making an announcement of where the patient is in the waiting room, for example, using that name would be dead naming that individual. And so, again, that would be considered a microaggression, but also for some people a macroaggression. And so, again, and then even when you're interfacing with your care provider, you run the risk of being misgendered. Or having to continue identifying a certain way so you get that treatment that you're needing.
Sure.
Another example of this would be people seeking PrEP. PrEP is a pharmaceutical that reduces the chances of acquiring HIV. It has I think, a 98% effectiveness if taken as prescribed. Don't quote me on that, but not a medical professional. But many people seeking a consultation about PrEP are associated with promiscuity, much akin to when women, cisgender women, are seeking birth control. There are many, many more examples I could come up with, but those are just a few, just to kind of highlight how we are kind of taught around reproductive health, and it's only being essentially advertised and marketed or delivered to people who reside on the binary as male or female.
Right. And I was going to ask, my next question, you kind of touched on this, the barriers to seeing a doctor or accessing healthcare. You've sort of given us some examples. What else can you think about?
Well, I mean, quite frankly, the list is long and wide. Much of the queer community faces discrimination when seeking healthcare services. So in the metro, this may be less so. But when you're looking at the suburbs and more rural parts of Minnesota, and even in other states, discrimination is rampant. And whether that's intentional discrimination, I don't know that. But in much of the time, it does exist. It could be as simple as when you disclose who your sexual partners are, a moving of body language, sitting back more in the chair, indicating that you're uncomfortable about this conversation, to glossing over things because you're wanting to move the appointment along, so not doing a thorough examination. So yeah, those micro and macro aggressions make it extremely difficult for people who identify within the 2SLGBTQIA plus community to disclose aspects of their identities that are important for healthcare providers to know. If you are a non-binary person being repeatedly misgendered by your doctor, the level of truth is just not there. So you're not going to ask things. You're not going to disclose things that are really important to your healthcare.
Mm-hmm. Absolutely. That's a really great point to highlight is trust with your doctor. If you can't feel like you're not showing up as your whole self, or you can't show your whole self to your doctor, your care might be compromised. And that's something that we want to sort of talk about and highlight. Also in my next question, too, let's talk about mental health services. What mental health services exist for LGBTQIA youth and adults? And then how would you recommend that someone who identifies as queer find the right mental health professional?
Yeah, great question. So a variety of services, from individual and group therapies, from a mental health lens, have been vital to helping integrate people's identities. It just creates a place of safety where you can explore the different variations of your identity, how you want to express that identity. And then also it helps you understand that identity isn't a constant state of flux. It's never fixed. We always believe that this identity is static, and once I've mastered my identity, then I can move forward. Well, no, it's a lifelong process with all, not just people within the 2SLGBTQI community. Okay, but therapy also is a vehicle that facilitates awareness of yourself. It increases your sense of agency, and it fosters really a sense of mastery over your life. It creates a space to just really be able to examine who you are, and then who you want to become, and how you want to align with yourself and the outward world. Okay, so when we always use the buzzwords like showing up authentically, therapy allows us to be able to do that.
Right.
And then I think you asked something about recommend someone.
Yeah.
Yeah.
Or like how would you go about finding the right mental health professional for you if you do identify as queer?
Yeah. So, I mean, if you're doing a general search online, I would highly encourage to put in keywords like LGBTQI plus, or use keywords as like therapist works from an affirmative therapy style. That can help ensure that you're getting connected with somebody who at least has some semblance of knowledge of the community and the pressures it faces, or we face. I would also, think about what are the most salient parts of your identity that come up the most, so that they don't become the cornerstone of therapy, but your therapist is aware. Right. So, I mean, you come into therapy and you're struggling with depression, and your therapist is all gung ho to talk about your sexual orientation, gender identity. That's not what you want to talk about.
Right.
That could be problematic. It could be a barrier to your therapeutic process. However, you want your therapist to know about your community and the pressures it faces, so that you don't have to do all the education, all that heavy lifting to educate your provider about who you are within your own communities. And so look for therapists who work from an intersectional model. That means understanding people from all of their identities. And if they don't understand the identity, that they're going to do their own work to understand you and not put that burden on you to have you educate them. So really be strategic in how you search out different therapists, and when you get into that initial session, interview your therapist. If they're taking defense to that, well, you can always find a different therapist. But if they're willing to engage you and explain who they are, understand that they don't have all the knowledge about identities, at least are willing to work through you in that process, it may be a good fit.
Absolutely. Thank you. Well, that is all the questions I have for you. So thank you to Dr. John Gatermann, Senior Clinical Psychologist here at North Point Health and Wellness Center. It's June, it's Pride Month. So thank you so much for answering our questions.
Yeah, I just want to say one last thing. There's lots of things in order to support the community, particularly during the month of June. Not just the Pride Festival, which is a nice way to support the community. There are lots of events going on locally, and so I would encourage people just to try to figure out a way just to engage. Maybe push yourself a little bit beyond your comfort zone, or if you're not a person who's very social, I get it. We're still living in a pandemic. Maybe just finding ways to support the community and different agencies that work with the community.
Absolutely. Thank you. Thank you for listening to North Point, Making Health Happen. We want you to know that we are here to partner with you, that you can dream, and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about North Point or find out more about the COVID-19 vaccine, check us out on the web at northpointhealth.org.
When you walk through the doors, we're here with open arms. We know the times get hard, and we're here to help at North Point. When you're feeling
low. Maybe something that people are more familiar with, pronouns. So you and I, as we're recording this, we have our pronouns here in our names. Maybe tell us why those are important, because I think maybe some people have misconceptions or just don't think that those are important.
Yeah, so I mean, you're seeing pronoun identification in a variety of capacities now, whether it's on our signature line on our emails, or you're seeing it as we've entered more of this Zoom era post-pandemic, that people are highlighting or indicating what their preferred pronouns are. Put simply, pronouns just take the place of a noun. We've been using pronouns for a long time in many different languages. We all have a concept of what a pronoun is. And essentially, we use pronouns to anytime we want to tell a story about somebody, or we want to reference somebody without using their name. But for much of the time, the pronouns have relied on the binary. And what I mean by the binary, male or female. So it's only been representing either one gender or another gender. And understand that this concept of that gender can only mean one or the other. And so pronouns tended to be more masculine or feminine, he, him, versus she, her.
Right.
Now, for the dominant culture or mainstream culture, pronoun usage isn't really even a second thought. It's done pretty seamlessly and effortlessly. If I look at somebody and they appear more phenotypically male, I'm going to use he, him pronouns. If they appear more phenotypically female, I'm going to use she, her pronouns. However, by just that assumption, that's a privilege that you hold. So if I am identifying as a male and my sex assignment at birth is male, that means I'm aligning with my sex assignment, which means cisgender. Okay. And so when I'm basing my own experience off as a cisgendered male and looking at somebody else and trying to identify their pronouns without asking them, that's privilege. Okay. And we'll get into more about that too as we kind of go along. But what we know about gender is that it doesn't reside neatly in a binary, masculine or feminine. Rather, there are many variations of gender. And pronouns are important in understanding those variations and give us the language to affirm people beyond that binary.
Absolutely. And I hear you about, that privilege aspect. And I think I'm hopeful to see more practices of asking people their pronouns. So, yeah. And along those lines, moving on to the difference between sex and gender.
Mhm.
This one, I think, stumps a lot of people. So can you give us a good explanation?
Yeah, absolutely. And it gets confused because oftentimes sex and gender become conflated, and they're actually very distinct things. They can be connected at times, but for many of us, even if we identify as cisgendered, again, you identify your gender identity aligns with your sex assignment at birth. Gender is still very varied in that respect. So, simple definition is sex refers to the biological assignment at birth. You've heard me reference that already. So, male, female, intersex, or vague expression of your primary and secondary sex characteristics. Gender identity, on the other hand, is specific. It's your personal sense of one's own gender. So how you actually experience yourself. And so gender identity can correlate with a person's assigned sex, or it can differ from it. And so if it correlates, that's again, if it's in alignment with your sex assignment at birth, that term is called cisgender, meaning from a scientific lens, cis meaning on the same side. And if it differs, we often use the umbrella term trans because it means across. And so kind of think of across the spectrum. And so more recently, we've introduced other terms to describe gender, such as like gender queer, gender fluid, gender vague, agender, non-binary, just to capture all the many variations of gender identity.
Okay, thank you. So we're going to talk about the word heteronormativity. So this one, I think it was, at least for me when I was in college, this one was kind of thrown around a lot. Can you give us a definition of heteronormativity?
Yeah, I mean, people may have heard this in college or may have heard it, engaging with, in conversation with friends or colleagues. It's come up quite a bit. Essentially, heteronormativity is a concept that heterosexuality is the preferred or normal, quote unquote, mode of sexual orientation. It's been extended to also incorporate gender identity. So understanding like we live in a cisgendered world, but it was originally adopted for sexual orientation specifically. I'm just making that distinction because so many times we do, again, conflate sexual orientation and gender identity, and those are two distinct things. So essentially, when you're applying it to gender identity, heteronormativity assumes that the gender binary and that sexual and marital relations are most fitting between people of the opposite sex, and it's harmful for people who do not identify as heterosexual or cisgendered because it inherently and quite frequently deliberately restricts rights and access to resources that mainstream and dominant culture have. And so the last thing I'll say about heteronormativity is that it furthered the divide between those who identify as heterosexual and cisgender because it kind of mutes the conversation. So if you believe that heteronormativity or the prevailing sense is that you should be romantically and physically involved with somebody who is the opposite gender, then you're kind of shut the conversation off that anything else exists.
Okay, thank you. Let's talk about gender affirming healthcare. And this is something that's been in the news lately too, so we can touch on that. But tell us why it's important for transgender youth to seek and to get gender affirming healthcare.
Yeah, this has been a very controversial topic as of recently, as you so eloquently put it, Biftu, because it is it's something that is impacting clients that I serve, and also that my colleagues serve, whether that's from a mental health capacity or a medical capacity. There's been questions about if you're a provider who is treating a patient from more of an affirmative model, so helping them support identity integration in whatever capacity, that if there was certain laws introduced, could you continue providing that care? And what are the ramifications for people who are seeking that care and then no longer can have access to it? Those are real questions that right now families in Texas, families in Florida, just to name a couple states that are really grappling with. But there's a lot of bills that have been introduced around restricting either access to care or more making it harder for the queer community to retain rights. And so just want to go over a few things because you can take my word for it, but these are some hard facts. This comes from the Human Rights Campaign that tracks kind of all the laws that have been introduced, or not laws, the bills that have been introduced. Now these aren't considered passed, right? These are just bills that are being introduced as potential for law. So just in 2021, there was 35 bills that would prohibit transgender youth from being able to access best practice or age-appropriate gender-affirming medical care. 69 bills that would prohibit transgender youth from participating in sports consistent with their gender identity. 43 bills that would allow people to assert religious belief as a justification for failing to abide by the law or provide services to people whom they disapprove of. And then at least 15 bills that would prohibit transgender people from having access to restrooms or locker rooms consistent with their gender identity. So, again, that's that further politicization of identities, but now it's being applied to youth, which you think about all the stressors a young person has on their plate with even going to school during a 2-year pandemic and post-pandemic, if we want to call it post-pandemic, navigating the challenges of identity and trying to integrate your identity and fit in socially, to being challenged now about what sports they can participate in, where they can go to the bathroom, are they going to be safe when they show up at school? These things all impact you, and so when you're dealing with a lot of those external pressures, they influence your internal process of how you make sense of life. And when that happens, then you start to see the increase of mental health problems. You see that increase in depression, anxiety, youth presenting with mental health problems that typically wouldn't present. And so you're still seeing some strong increases in suicidal ideation and also suicide attempts among young people. And then you think about from a medical lens, and again, I'm not a medical doctor, and what I'm hearing from colleagues, but also from research, is that you're seeing increase for eating disorders, weight problems, stress-related disorders, and so it is a concern when you look at it from a more of a broad lens of what do these bills actually do, what's legislative, and how does it impact the person that bill is designed to affect. And so even though things aren't happening in the state of Minnesota right now, doesn't mean that things that are happening in other states aren't impacting our young people.
Yeah, absolutely. I think it's safe to say for those who are living in those states that are introducing these bills, it's extra scary. And then for those of us who live in places like Minnesota, we can't be complacent and think, oh, that'll never happen here. I think every time we see that, we must stand against it. And so you've talked about this a little bit